I got to see a family health team, which I never did before. I got to see the hospital and community pharmacy, so it was nice to get a, like a whole big picture of what the pharmacist's role is in different settings. I definitely really enjoyed working at the hospital at Sault Ste. Marie. There were a lot of opportunities for students to see a variety of different areas of practice.
When you first come out to start rotations, you're very unconfident in your abilities. I really felt like I was behind on my clinical knowledge, my work.
And the biggest thing I learned is how to compile all the knowledge you have and do a patient workup in the most effective time.
My preceptors had this wonderful way of supporting me and encouraging me and telling me to use the knowledge that I've learned thus far. And they always told me, you know more than the patient, so you're going to teach them at least one thing.
My preceptors in community were really good at helping you come up with the, the tools you need and the thinking process to find the information that you need.
So I think the one thing that I learned the most from some of my preceptors was just kind of to be a little bit more confident in what you're saying and your abilities. I definitely was able to gain some pretty quick confidence with some of the remarks that they made.
To have the direction of where to go to find the information was great and very practical.
But Niagara, this is the first time that they're getting pharmacy students, so they're pretty welcoming. They make sure that you enjoy your stay. They invite you on weekends for dinners. If they're doing any fun activities.
I felt like I was really able to get a lot of hands-on experience with the patients, interact with them and talk with them a lot. Every day you can see the impact that you're making, and then at the end of the day you get to come home and tell your friends or tell your family, oh my gosh, you'll never guess what I did. Like all these things I learned about in IPFC, I actually did it today.
At the hospital in Owen Sound, I was the pharmacy representation on the stroke team. So I basically saw and did a medication review on every stroke patient that came through the hospital. So that was kind of neat to do.
If I ever needed support, I would turn to my preceptors. They would give me all the resources that they could in terms of their setting.
So I think my preceptors were probably the biggest resource I had.
And every single rotation I had really amazing people, amazing preceptors and amazing team members.
Having gone through the rotations, I've met a lot of amazing preceptors, a lot of people who've given me a lot of great guidance and advice. It's a very precious and invaluable experience.
I'm grateful to have such a wonderful experience with every single one of my preceptors.